Right, we are here with the owner of the clinic, Kim Shirk. Kim and I have been friends actually for probably about 8 years. In that time, 4, almost 5 kids, 2 medical centers. How do you do it?
You know, we had a need in our community and somebody had to fill it. And I've always known that the body has the ability to heal itself and believed in the theory of functional medicine, but didn't know what it was called. So we just kind of set out to provide wholesome care to families, and what has developed has been amazing.
Absolutely. Yeah, tell us a little bit about what the practice looks like now, because I know you're a PA, but this is a real integrated center at this point.
Yeah, so it's very uncommon for PAs to own their own practices. We have a wonderful physician that works with us. She's on board full time. She's learned a lot about functional medicine. She didn't know anything about it before we kind of recruited her.
Yep.
And so we provide care for families that want to get to the underlying issue. You know, we do everything from pediatric care all the way through geriatrics.
Well, so then what are some of the other practitioners that you have working in the space? You have the PAs, the doctors, you do some lactation stuff. What else?
So pediatrics is our main focus. I tend to have a passion for well babies and growing healthy families. So for me, it was important to have full-time lactation support. So we do that with a lactation counselor who's here 4 days a week.
Yeah.
She also bills through insurance, which has been really helpful for getting that type of coverage, because we also had to be competitive with the local pediatric groups, right? They all have lactation counselors on staff. They all bill through insurance. So we had to kind of navigate that model as well.
Yeah, exactly. What? You know, you have the space here. We're in the group education sort of yoga for the spaces here. What other spaces have you got in the building?
We have a designated lactation room.
Yeah.
We have a nutritionist, health coach that works with us. We also have a personal trainer who does rehabilitation for diastasis recti. So again, looking at the whole family model, postpartum moms, we were looking at what are their needs and what do they need more. And that is rehabilitation for postpartum bellies.
Awesome.
And that's worked great.
So one of the main reasons I wanted to come, the last time that you and I were hanging out with your husband in San Francisco was at the HINT Summit, where they were talking about direct primary care. So talk about how you found out about it, why you chose to use it, and just maybe share a little bit about the model that you've chosen to run, because I think this is one of the most innovative pricing models that I've seen in pediatrics.
Our model is a lot of fun, so it's definitely something different. The void that I was seeing in functional medicine was that you had this amazing practitioner who could help you, get to the root of all your illnesses, but if you got a sinus infection, you had to go to urgent care, or you had to go see, your old family doctor who had no idea what had been going on with you for the whole time. And I love family practice. That's been my passion. That's why I went into medicine. So incorporating that into a functional medicine practice was really important to me.
Yeah.
So our model is a membership-based model. Our patients pay $25 a month per person and their family, with a family cap at $100. So no family ever pays more than $100.
Okay.
That includes direct access to me as their practitioner, so they get texting back and forth and email, and then well baby visits are included in that as well.
Wow.
Every follow-up visit is $50, so whether it's a sick visit or a functional medicine follow-up visit, it's always $50. The initial consult is $150, where we spend an hour and a half with the patient. We get to know them, we get to know their family, the social dynamic, plus get to the root of the underlying issues.
I love the idea of having a very affordable basic layer and then these other layers on top. Yeah. How did you sort of come to the numbers, and how did you work out? Because before you were in upstate New York, now you're in Columbia, South Carolina. How did you sort of work out, one, whether or not people would go for this here, and second, what the price should be?
Honestly, Facebook has been my driving force for all of this. So when I first decided that this was a model in theory that could work, I started a Facebook group for local moms in this area to see if they would be interested, if they would even be willing to pay out of pocket, if it meant that their pediatrician was on call for them 24/7, not calling and getting a nurse, not calling and getting someone who's never seen your child before, but they get me directly. And there was a huge demand. And I actually was really surprised. I thought some people would get it and other people wouldn't, but people jumped like crazy.
Absolutely.
So it's been wonderful.
Yeah, Facebook is awesome. So he says the Holistic Mums group, and that's accessible to anyone wherever you are. There's chapters all over the country, all over the world, I think, right?
Yep, exactly.
So also you've been such a great member of our, Practice Accelerator and the membership Practice Builder. It's been really amazing to have your input into it. And as other people are starting to see it, our vision for the Accelerator was really to make it easy for each next doctor, next practitioner to do it. Facebook and some of that marketing. I mean, what are some of the things that you've sort of taken away as you've, built this practice? And what are the things that other practitioners could learn from building the center things you've done so far?
I think, I think if anybody can do it, if I can do it, anybody can do it, because I've, had 4 babies since we started the practices, and we're working on number 5. So there's a lot of time constraints. I only have so much time. But it's important to take it just one step at a time. It's important to have a big picture, but know what your short-term goals are and just work on achieving something small. Again, if you told me 5 years ago that I would be in this multidisciplinary health center with other practitioners and other physicians and PAs working with me, I would have never believed you. And as the need grew, we just filled it.
Yeah, and your vision gets bigger as you're actually competently executing the different phases in the plan.
Exactly.
It must be fun to be able to work with your husband, and he's like sort of working behind the scenes. What would you recommend for other practitioners who are sort of like, maybe scared to take that first step towards where they need to go?
I think it's really important to know what your own limitations are. I knew for me that my strongest suit was in the clinical aspect. And so when we started to grow beyond me being able to do 5 hours of administrative work every week, then I knew that I needed somebody else who believed in our vision, who understood but wasn't necessarily medically trained, who could support my ideas and kind of execute my plans.
Yeah.
So.
Well, look, it's been amazing to go on this journey with you and see the whole thing happen. If you want to be part of the most interesting and innovative group online, come and check out the Practice Accelerator. You can find out more information on the details below. But Kim, congratulations. Like, I really feel like this is something that, any practitioner who's out there can build a practice and can employ a physician, right?
Absolutely.
We don't have to wait for the pediatricians to get it.
Right.
If you build it, they will come. And this is happening in South Carolina, and it can happen wherever you are too. Thanks so much for having us a part of the practice, and good luck with the future. Who knows where it's going to go.